or if you have questions, you can raise. If you have questions, you can raise your hand and then we pick up after everyone have spoken. So our first presenter is Tinashe. So Tinashe, can you go ahead and just introduce yourself and then pick from there? Thank you.
Thank you so much. So I would like to present about the Computational Omics and Biomedical Informatics program at UCT, which is a partnership between the University of Cape Town, UCT, and Oregon Health and Science University in the United States. Just in terms of the key personnel, these are the personnel involved. We have myself and Professor Nicola Mulder, and Dr. Rosin Bendu from the University of Cape Town, and we have Professor Bill Hirsch, who's leading the efforts at OHSU in the States. So the whole idea or the motivation is for behind the training program is to provide an interdisciplinary training platform in the fields of multi-omics, machine learning, and ethical considerations. In essence, we're trying to fill a critical educational and research gap, which we identified with regards to capacity in data science and medicine. And so the vision is to pioneer biomedical data science education on the African continent. Specifically, this is being done through developing an interdisciplinary data science training program focused on health and healthcare needs and priorities of Africa. We also are training faculty from relevant disciplinary backgrounds from our collaborating institutes to support the development of the field, not just in UCT, but across the continent. And it is our aim that towards, or after all is said and done, we'll establish COBIP as an international center of excellence in computational omics and biomedical informatics, and that we would have a distributed network of African institutions following a similar curriculum, a sort of similar framework for teaching data science. But the focus will always be on African health priorities. So just in terms of expected outcomes, we would want to attract cohorts of trainees from diverse backgrounds, including mathematics, statistics, informatics, computer sciences, engineering and biomedical sciences. And we would like to see at the tail end of this program that we have an innovative educational, we've provided an innovative educational infrastructure and research opportunities, as well as links between clinicians, researchers, and industry, particularly biomedical industry, through placements and internships for our students or participants. And of course, we'd want to impact on African biomedical data science research and stimulate diagnostics, therapeutic selection, and drug development to support the improvement of human health and healthcare in Africa, but also globally. Concretely, what we have from our training program is a 2-year master's, Master of Science in Computational Health Informatics, a 4-year PhD in Computational Health Informatics, and a faculty training program. These programs were born out of a realization that there were expertise already existing at the University of Cape Town in bioinformatics, biomedical engineering, imaging and computation, and statistics, whereas our Oregon Health and Science University partner has expertise in, or that institution has expertise in clinical informatics, research informatics, and data science. So in terms of our progress so far with our first aim of developing the interdisciplinary data science training program, we've now got an accredited program. We've established agreements between ourselves and our partner institution. We've already had some students do some of the online courses that are available at our partner institute. We've finalized our hiring. We've developed content for the master's module, and we've appointed members of a training advisory committee to guide us in our training efforts. What is ongoing is the recruitment of trainees, particularly the masters and PhDs. And I'll talk a little bit about this at the tail end of my presentation. In terms of our AIM2 training faculty from collaborators, we have already initiated plans for onboarding and training with our partner institutions from the countries on the right. And in this October, we will be having trainees from these various countries joining us in our professional development workshop. And the idea is to already start with the curricular replication efforts of COVID to their institutions. And then in terms of AIM3, which is what we're doing towards establishing an international center of excellence, we are definitely part of activities such as this, which are the networking events from DSI Africa. And we are planning some doctoral symposia to be run on an annual basis with students who are interested coming from across the continent. The modules that are offered at UCT for the master's program are on the slide here, although PhD students and African faculty would also be able to take this on. In terms of compulsory modules, these are at the core because they actually they are the data science component, but students can then choose electives from a wide bouquet of courses that are available at the University of Cape Town in all these different domains. But also because of our partnership with OHSU, we have some modules that are taught online, whereby students at the University of Cape Town enrolled in our program can join asynchronously video discussion forum interaction. And the courses that are available are more catered towards health and clinical informatics. We've appointed the training advisory committee from leading scientists, mainly from Europe and the US, and some representation from industry. And we're hoping that with their input, we can make our program a class-leading program. We are currently, as I said, enrolling for 2024 for the master's program. So for those who are interested in the master's program, this will be the link to apply at the University of Cape Town. And for those who are interested in the PhD, you can email myself directly, and would have to set up with potential supervisors and see what opportunities are available. There are some scholarships, a limited number which are available on a competitive basis, but they're only available to those who would have already been accepted into these two different programs. So please, if you're interested, do go ahead and send in your application or contact me. Thank you very much.
Thanks very much, Tinashe, for this insightful presentation. So our next speaker is from the DS Change program. That should be presented by Christy McKinney and then Peter Amwako. But I think McKinney is here, who will do that delivery for us. Please go ahead, Christy. Christy, yes, we can see your slide, but apparently we can't hear you speak.
I'll try one more time.
Okay, that's fine.
Okay, so there we go. We'll get started here again. So this is a multiple PI program. I'm an epidemiologist and I focus on my research in cleft and nutrition, and I co-PI this project with my colleague Peter Mayoge-Yorenchi, who's a mathematicist, and Professor Peter Donkor, who's a surgeon and focuses on injury in cleft. We have 3 program aims. These aims are to deliver a comprehensive mentored interdisciplinary training program and that cross-sects data science methodologies, health conditions, and biomedical domains. We are focused on increasing Kwame Nkrumah University of Science and Technology faculty based in Kumasi, Ghana, and their institutional capacity in biomedical data science, and then to develop proficiencies in team science, since data science is such a team discipline. So our focus is in these 3 kind of primary health domains for child health. That's malaria vaccine development, injury prevention, and orofacial clefting, which is a type of birth defect, and cross-secting these with a variety of health data science skill sets. We have a number of partnerships from the Seattle Children's at the University of Washington, where I'm based, to the National Institute for Mathematical Sciences in Ghana, as well as the Ministry of Health, and Smile Train, which is a nonprofit that focuses on providing surgical care for children with orofacial clefts, that has a database of 1 million surgeries over the last 20 years that our students will leverage for their analytics. So our program, in terms of developing new degrees, we have a master's degree and a PhD, and there are 3 tracks in public health, computational imaging, as well as computational biology. And these are our current students. We have 10 students, 3 PhD and 7 master students. We're pleased that half of our cohort is women, and they come from a variety of backgrounds, from medicine, biochemistry, biology, and are focusing on these areas of public health, computational imaging, and computational biology. I think that's all I have for now, and I'm happy to take questions at the end after we're all presented.
Great. Thanks very much, Christy, for that comprehensive presentation on the DS Change program. So our next speaker is Haley Senkmar. I hope I got it right. Who will speak to us on the WASHI TAKWIMU projects, please. Go ahead.
Great, thank you. One moment. Okay, great. Hi everyone, my name is Haley Senkmar. I am a research and program coordinator at Harvard Teach Chan School of Public Health, and here to talk to you about our program, WASHI TAKWIMU. So we are the research training on harnessing data science for global health priorities training program. We renamed to WASHI TAKWIMU, which is Swahili for Ignite Data. And WASHA stands for Working on Applications for Data Science and Health in Africa. Our training program is focused on advancing health data science methods, and specifically we're hoping to address global health priorities. 2 that we are focusing on are climate change, food systems, and planetary health, as well as health system strengthening. Here's kind of an overview of our program structure. So we are a joint effort between Harvard Teach Chan School of Public Health, University of KwaZulu-Natal in South Africa, and Heidelberg Institute of Global Health in Germany. And UKZN in South Africa is our hub, and then we have 4 spoke partners throughout Africa. Muhimbili University of Health and Allied Sciences in Tanzania, and that's led by our spoke partner, Candida Moshiro. University of Ghana, led by our spoke partner, Prof. Chris Gur. University of Ibadan in Nigeria, led by our spoke partner, Professor Angela Chikwu. And Makerere University in Uganda, led by our partner, Prof. David Guvitude. Our 4 PIs are listed here. So Wafai Fauzi from Harvard, Till Berenhausen from Heidelberg University, and then at our hub, UKZN, we have Deputy Vice Chancellor, Professor Mosa Moshabella, and Prof. Henry Mwambi. We are also supported by Executive Committee committee members from Harvard, Heidelberg, and UKZN who provide support on our different activities that we'll go over, as well as some of our supervisory teams for our trainees. And then we also have a training advisory committee board who we meet with regularly to provide advice and support on our program. And here are some of the faces behind our leadership team. I'll just go through these quickly for the sake of time. Here are our spoke leaders from our 4 countries of Uganda, Tanzania, Nigeria, and Ghana, and our lovely executive committee and advisory board. So a bit of an overview of our program. Our long-term goal is to develop advanced data-skilled researchers in health data science in Africa, and we're doing this through a rigorous curriculum and a number of training and research activities to address global health and public health challenges in African countries. Specifically, we aim to train researchers at UKZN, which is our hub, to educate and conduct research in the fields of data science to address some of these global health challenges within South Africa and throughout the region. Additionally, we are building a mass of public health and medical professionals throughout the region of sub-Saharan Africa. So within our countries of South Africa, Ghana, Nigeria, Tanzania, Uganda, and beyond, who can design and conduct these research projects using health data science methods, and culminating in a master's degree program in health data science that will take place at UKZN to lead to capacity building. So some of the specific activities, we offer faculty training, postdoctoral training, intensive short courses, annual symposia, and then monthly seminars. All of this will culminate in that Masters of Health Data Science program at UKZN. And all of this is to have a long-standing, sustainable approach to these training efforts. A bit more detail about each of these activities. So for the faculty training, we will have 4 faculty members from UKZN come to Harvard School of Public Health, as well as Heidelberg, and engage in some other training activities with the goal of building their skills and capacity in data science methods so that they can then contribute to the new master's program. Training will occur in this upcoming year in 2024. We also offer postdoctoral fellowships. Our goal is to recruit 5 postdocs to train. This is a 2-year fellowship, and they would train at Harvard, at UKZN, and Heidelberg, as well as their home institution during this time. They are trained in specific data science methods, as well as one of the domain areas, the global health focuses of their choosing. They receive support from supervisory teams, mentors from each of our partner institutions, and our hope is that they will then serve as faculty on this new master's program as well. We also offer them seed research funding so that they can use the $15,000 we provide to support their research proposal during the 2-year fellowship, as well as other training activities that they may engage in during this time. Here are 4 postdocs who we've had involved in our program so far. 2 have been funded by our DSI program, and then we have had 2 others who we've engaged with. And we did just have an advert close for a new cohort of postdocs that we are hoping to recruit. And our goal is to now have a cohort of 3 new postdocs who will be coming on in the next year. We also offer a monthly seminar series. So this takes place the 3rd Wednesday of each month. One of them is actually taking place right now during this call. And these are on various topics in our focus areas. So data science methods and our domain areas of health system strengthening, climate change, food systems, and planetary health. We have speakers from Harvard, Heidelberg, UKZN, our spoke partners, and larger DSI consortium partners. And they're an opportunity to hear about ongoing work, lessons learned, and for others to network and engage and learn about the field. Here's just a brief example, snapshot of some of the previous seminars that we've had. Our next activity is intensive short courses. Our goal is to teach 14 short courses throughout the first 4 years of our program. We offer courses in the health data science methods, as well as our 2 domain areas. And the short courses are on average about 2 weeks long. They typically take place on campus at UKZN in South Africa, and then some of them are offered virtually as well. The goal is to train the junior professionals from South Africa, our spoke partners, but these courses are also open to anyone throughout Africa. We do offer travel awards for those who are from our spoke partners. Unfortunately, we are not able to offer them to those outside, but we do welcome applications. Here's an example of the courses that have taken place and are planned. So we have a number of courses in the data science methods that have taken place over the last year or so. We had 2 courses this past summer, one in our climate change, food systems, and planetary health field, one in health systems strengthening. We will have the second courses of each of those respective domains in the upcoming year, in 2024. We also plan to repeat our suite of data science methods courses. Likely in the upcoming year, we don't have dates set yet. But if you're interested in any of these, I'll have my email at the end of the slides here. And we can certainly add you to our listserv so that you are informed when the courses will be taking place. And lastly here, we do have a boot camp in climate change that will be taking place this October. Each year, we have an annual symposia meetings that take place in South Africa and are open to the broader scientific and public health communities so that we can really cross-pollinate between disciplines. As we know, health data science is a multidisciplinary field. It allows us to share collective experiences and lessons learned in the field and collaborate with others globally to understand experiences in their country as well. It's also an opportunity for us as a program to check in, evaluate how we're doing, what our progress is, and keep in touch with our trainees. As I previously mentioned, all of this will culminate in a master's in health data science program that will take place at UKZN. Our goal is to enroll 15 trainees in this master's program by the inaugural year of 2026. And the program will have a rigorous curriculum made up of statistics, computing, and health data science, which are the pillars of health data science. And then the previous activities, so our faculty who receive training, our postdocs who receive training, we do hope, as I mentioned, that they will be able to contribute to the facilitation of this program. We also will have a culminating workshop at the end of the program to kind of check base on our collective experiences during the training program, how we did, and then thinking forward for future work and how we can expand this blueprint to our other countries. Just take a brief moment to acknowledge all of the internal team and others who have contributed to these efforts and supported our program. And as I mentioned, here's my email. We'll also put it in the chat, but for anyone who's interested in any of these opportunities, the seminars, the courses, or fellowship positions, you can certainly email me and I can add you to our listserv to keep you in touch about opportunities. Thank you.
Thank you very much, Haley, for that detailed and comprehensive presentation. So we would now move on to take questions and answers from the participants. So you are permitted to raise your hand, or you can send your message in the chat room, and then we can pick things from there.
Hailey, you are sharing your screen, eh?
Yes.
There we go.
Thank you. Yep. I think there's already a question for Haley from Emmanuel. When are the short courses of the data science held or advertised? Are there any coming up anytime soon? I think you made mention of this, but if you would like to provide additional information.
Sure. So we did just go through our whole series of courses for 2023. So we do not have any upcoming for the remainder of this year, but as I mentioned, we will repeat our data science methods courses, and then we'll hold 2 more courses in each of our domains in 2024. The dates have not been set yet, but we do send out advertisements a few months in advance. And so as I mentioned, I can add you to our listserv if you're interested, so you can get those advertisements and plan ahead for once those courses are officially scheduled.
Great, thanks very much. Any other questions? Okay, I think not so much. Thanks very much, Ima. Ima says interested in joining the data science series. I'm sure you see the emails, and I'll just request the presenter to all presenters to just send a message or your email address on the chat, so that those who are interested can speak to you probably after this. Christy, will you probably want to make any additional comments from your presentation, or Tinashe?
Yeah, I guess I would just say if anybody's interested in learning more, you're please more than welcome to email us and start a conversation.
Sure, great. Tinashe, we can't hear you. You're apparently muted. Yes, now.
Okay. So along the same lines, if anybody's interested in what we presented or any opportunities, please feel free to email myself. We're very open to collaboration and we'll happily answer your questions.
Great. So we still have almost 30 minutes to go. So those of you who are interested in going to other rooms are more than welcome to do so. But let me indicate that all the organizations and projects that are in this network today, their information is on our website, the DSI Africa website. So I encourage you to take a look at that. And then our recordings today will also be made available in our YouTube channel. So those of you who want to still have a look at what took place today, you're more than welcome to also visit our channel. Okay, thanks very much, Tinashe, and all the presenters for availing yourselves today and presenting on your projects. We thank you, and also the participants for coming around. Those who probably would want to leave, that is fine.